Good morning and welcome to another edition of Courtyard Mobility. Guys, some great and exciting news. I've decided Dane Smith Corrective Training now has its own YouTube channel. So guys, please, I'm going to be posting some longer content throughout the duration of lockdown and going beyond lockdown into the rest of the year. So if you want to be able to see the rest of the videos, the full content of the videos, please go to my YouTube channel, Dane Smith Corrective Training, and like, subscribe, and then you'll be able to see the whole videos. Unfortunately, there are time caps on certain social platforms, so yeah, please go check it out, and it'll be amazing to be able to provide this content for you. Okay, getting into today's session, we are going to be talking about pain and, let's say, numbness and tingling in the hand, fingers, and down the arm. There are a few things that can lead to this kind of situation, this predicament, but what we are going to focus in on today is let's say a condition or a situation which is named thoracic outlet syndrome. Okay, basically what is happening is the compression of certain vessels up in the shoulder, neck, which is then leading to referral symptoms down the arm. Now, it is quite a tricky diagnosis, and like I say, there could be other things going on. So if possible, get checked out by a medical professional. But unfortunately, if you don't have time and you are in, let's say, lockdown, and you can't get an appointment with any of your essential providers, then check this out, give it a try some of the techniques, and maybe it could provide some good relief. So first up, what is thoracic outlet syndrome? So like I just mentioned, the compression of certain vessels, irritation, could be traumatic injury, but usually it is the compression of nerves, vessels up in the neck, which then, like I said, causes a referral down into the hands, fingers, and down the arm. Okay, so two structures which we are going to focus in on today, muscular, is the scalene complex and the pec minor. Okay, the brachial plexus, all right, vessel will run between or under the scalenes. It'll pass through underneath the rib, all right, first rib, collarbone area. It'll then pass underneath the pec minor and then down into the arm. Okay, guys, what happens, we play a lot of sports, especially now in lockdown. We're doing a lot of burpees, a lot of push-ups, a lot of overhead motions. Okay, those structures can become quite tight, all right. And similar with the piriformis in the hip, when it gets tight and puts compression onto that structure, you can feel referral symptoms down the leg, or in the piriformis syndrome, or in this case down the arm. Okay, so we need to concentrate on how do we relax the structures of the pec minor, structures of the scalene. How do we get that nerve to kind of relax, a little bit of neural lengthening, releasing that neural tension, and then how do we fix the overall picture? Okay, so obviously we can't just bash away at the pec minor and scalene every time that we feel these symptoms. We need to get to the bottom of what is going on. Okay, so that is a quick little overview on thoracic outlet syndrome. Like I said, please, if you are experiencing pain and numbness and tingling down into the structures of the hand, I would consult a medical practitioner just to clear out any red flags. But if you do know that this is what you are struggling with, then please go ahead with these techniques. Okay, so first up, getting into our stretching and releasing, we need to kind of work up into that scalene structure. Okay, guys, there are two ways of doing this. If you are unfamiliar with the scalene complex or the anatomy of the neck, please follow the stretching guidelines for today. If you are familiar with the structures and anatomy of the neck and you are comfortable with doing a little bit of prodding around, you can go onto the release portion. Okay, so I'm going to show you the stretching part first. So what we are looking to do, nice tall chest. Okay, scalene structures, you have this big kind of meaty muscle over here called your sternocleidomastoid. The scalene is just on the outside of that. Okay, so if I had to take this guy, just move him out the way slightly, the scalene structure would sit into this little complex or this little region over here. All right, so to stretch that, what we are looking to do, we're looking to look up slightly and then tilt our head away from the structure. Okay, so again, we look to look upward and drop our head just to the side. You should feel a really nice stretch coming into this zone over here. Okay, you can hold that 20-30 seconds. You can add a slight little bit of pressure, not too much. Okay, and you can look to do that a couple times just to get some release and some stretching and open up that scalene. Okay, secondly, we're going to work through the release portion. Okay, so like I said, if you are comfortable with doing some poking and prodding, this is how we do it. So we find that sternomastoid. Okay, we take that opposite thumb and we're just looking just to go to the base. Okay, you should feel that collarbone here. First rib will also be there. Like I said, that brachial plexus is moving through and underneath structures. So we're looking to grab here, find right at the base, just on the outside of that SCM, and we're just looking just to move upwards on the outside of that portion. Okay, so find a little kind of knot. I know there is a little bit tender for myself. Okay, so I just look to add a little bit of movement around there. Guys, please, if you feel like you're getting any burning sensations down the arm or whatever, move around until that disappears. We don't want to be pressing onto that brachial plexus and causing further discomfort. Okay, so we're just looking, trying to hit that scalene. So again, SCM at the bottom here, and I'm just looking to work all the way up. Okay, generally down at the bottom, that's where you get some nice referral, and I'll work, I can add in a little bit of lateral deviation on my head. There we go. Okay, next up, so we've done some stretching of the scalenes, we've done some release work. Next up, what we're going to do is we're going to focus in on that pec minor. Okay, so pec minor helps in breathing, but also it will draw our shoulder blade or pull us forward. Okay, tips that scapula forward. All right, we need to be able to open up that structure, get that pec minor a little bit looser so that it's not pressing down on that nerve structure. Okay, so what I've got here, we take this ball. All right, I'm going to work on my left side. All right, just for the camera. Okay, so what we're looking to do, importantly, we have our big chest muscle over here. We need to be able to move that chest muscle out the way because the pec minor sits right underneath that. Okay, if we go smack bang on the chest, yes, you might get a little bit of relief, but we're not truly getting what we're looking for. So how we do that, what we're going to do is we're going to lift this arm up above the head. We're going to take that ball and we're just going to wedge it in over there. Now you could even do this just in this kind of seated position, and all I'm looking to do is just find that pec, move it out the way slightly, and then just press down until you find there. I know for me, right there, and I can just wiggle that around. I could even move that arm up and down and around. Okay, another way we can do this, lying nice and flat. All right, I take my ball, arm out in front of me, I find that pec structure, and all I'm doing is I'm just lying flat on that ball and I can just wiggle around. Okay, nice big breaths in and out. Alright, there we go. Okay, so again, 20 to 30 seconds of some release there, looking just to release that pec minor up. Okay, once you've done both scalene, pec, you should already start feeling a little bit of relief, but we still got more to do to tie it all together. Next up, we're going to do a little bit of thoracic mobility. Okay, that T-spine can often lock up, which then limits the movement and rotation of our spine, which could also be an exacerbating factor to this thoracic outlet syndrome. So what we'll do, a couple techniques here. Let's grab a roller, pop it into the back, okay. Just move up and down. All right, I can hold it nice and flat, or nice and still, should I say. Move into extension. Okay. Or I could come into a side lying position. All right, I'll support my head there. I bring one leg up, top leg, and I can rotate, open. All right. Breathing, maintaining breathing throughout. Okay. Right. So a little bit of thoracic mobility going a long way, and that rounds up our kind of smashing and release portion. Okay. Next up, we're going to talk about some nerve gliding / nerve flossing. Okay, often that nerve can become quite tight and irritated. We just want to help get that nerve to start gliding properly again. How we do that? So I'll work on my left. All right, you take your arm out, and from here, I'm just looking to pull my hand down and take my ear the same way, followed by pulling that hand up, taking my head the opposite way. And I'm just going to repeat that. Okay. Or I could do it the same way. Tilt in and out. In, out. And I can feel a really nice stretch coming down and along my arm. Alright, so a little bit of nerve flossing there. You can play around with that while you are doing your scalene work, while you're doing your pec work. All of that should bring you to some really good relief. Okay, you should be feeling a lot better after that. However, we do want to work at kind of fixing the whole picture. How we do that? Okay, we're going to be concentrating. If our pec minor is quite tight, we'll be drawing our shoulder inward. We want to try and pull that shoulder open. Okay, so posterior shoulder strength, really important, but also serratus anterior strength. Okay, serratus anterior, responsible for that upward rotation, but also lifts the ribs up slightly. Okay, we want to focus on just getting those structures a little bit stronger so that we don't rely on or are drawn forward and tight in that pec minor and chest region. Okay, so what we do, common TheraBand. Okay, in nice and close, we draw our arms together and just pulling that band open. I keep my chest nice and tall. Again, drawing that band apart. Okay, little vision from the side here. And draw that apart. Okay. That is going to work. Our external rotator is going to help open that chest up, getting some stretching in on those front structures. Next up, we're going to just do a quick little plus variation for the serratus. All right, set up, we're coming in on our knees. All right, and from here, we're just looking to draw into a neutral / a little bit of scapular retraction. From there, press out as much as I can. I draw in and out as much as I can. Draw in and out as much as I can. Okay, that is getting that serratus to work and pulling that scapula nicely along our rib cage. Okay, getting it to protract well and helping in the movement of how our scapula moves. Okay, again, both of those exercises will help at the whole picture of sorting out any shoulder dysfunction. Right, with that all said, okay, one more huge and important aspect of thoracic outlet syndrome that a lot of people will not really think about is breathing. Okay, so scalene, pec minor, they both work a lot in breathing. Okay, So usually I know in cases that I've seen individuals who have short, sharp, shallow breaths, okay, they're doing a lot of whether it be running, whatever, any form of cardio exercise, often those structures, the scalene, the pec minor, all those muscles of inspiration, okay, they taking air in, all right, they are short, tight, and usually not happy, okay. So importantly, we need to learn how to take big breaths in, big belly breathing, filling our lungs, tummy, diaphragm, whatever you want to call it, with air, and get our breathing up to where it needs to be, okay. We could work through all these kind of methods, but if our breathing is off, we're still going to be struggling with the symptoms of the thoracic outlet syndrome, okay. So some breathing, we want to focus on lying nice and flat, okay. We want to fill our lungs and every structure around that full with air, okay. So nice big breath in and out, okay. Big deep breaths. All right, from there I could even add this breathing into exercises that I have been doing. All right, so if you want to do any band pull aparts, your external rotations, adding in that breathing component while we are doing them could work at really starting to sort out this breathing problem. A conscious effort while doing cardiovascular activities, all right, focusing on those big breaths in and out and not those short, sharp, shallow breaths, which could then go at causing structures to become short, overactive, tight, and angry. Okay, so breathing, again, very important. Guys, that's it for today. Courtyard mobility. We got a much longer video today, so please again check me out on YouTube, Dane Smith Corrective Training, and we'll be back for another session soon. Cheers.